Great job. Good afternoon, everybody. I hope everybody is staying warm and dry. Welcome to the Fishtown District's, I think, much needed and much appreciated virtual seminar with the city of Philadelphia regarding vaccinations, both in types, current status, and what we can expect in the future. We appreciate all of you joining us today. The seminar will be read by Alex Skula from the city, so we're going to turn it over to her shortly. Presentation should take about 20-25 minutes. We will have time for questions in the end, so we're going to keep everybody muted. Certainly, if you have anything you want to bring up, you can put it in the chat, but we'll certainly make sure we have time to cover it in the end. And with that, Alex, I want to turn it over to you, and Randy can share a screen.
Okay, I'm going to share my screen, make sure everything's working. All right, is anyone unable to see the big slide? Does it look all right?
We got it.
All right, perfect. All right, so I'll get started. My name is Alexandra Skula. I'm the Community Preparedness Manager at the Philadelphia Department of Public Health. So our program works really closely with the city's immunization program to coordinate distribution of vaccines, COVID-19 vaccines specifically. So today I'll give just some updates on where we are with the vaccine rollout. I will talk about the vaccines themselves. So what products are available, what can you expect from them, and talk a little bit about kind of what we call the COVID vaccine facts. So just some top line messages that you can share with your constituents about what these vaccines are and what they are not. And then I will talk about vaccine distribution. So this is really who can get vaccine when, and how can you get vaccine, or how can you sign up to get vaccine? And then of course, we'll have some time for questions and discussion. Okay, so currently Philadelphia is vaccinating people who are in phases 1A and 1B of our prioritization strategy. I'll talk a little bit about what that strategy is later. Essentially, we are allocated a certain number of doses each week from the federal government. And because those doses aren't enough for the entire city population, we need to prioritize who can get vaccine right now because we just don't have enough for everybody who wants it. We hope for that to be a reality sometime in the near future, but right now we are prioritizing based on risk of exposure and risk of getting very sick from COVID. So to the right is a picture or a snapshot of our vaccination dashboard. You can find this on our website at www.phila.gov/COVID. There's a little tab that says vaccines on it, so you can just click on that and it'll take you here. So this is really so you can see how many doses we have administered and who has gotten those doses. So we've done almost 165,000 first doses thus far, about 82,000 second doses, and then you can see race and gender, age and gender breakdowns, and then we have something new, which is our vaccination rate per 10,000 residents per zip code. So you can see which zip codes of residents are getting vaccine. We also have this new weekly distribution update that we are putting out. I think we started doing this last week. So this is really just a summary of the different types of sites and where they are that are administering vaccine right now. You should not use this map or this site to request appointments because all these different sites are doing appointments for different kinds of people and they might not have appointments. But if you're interested, this will just give you a sense of the kinds of places that do have vaccine where you might be able to get an appointment in the future. And you can also find that at our website, phila.gov/COVID. Okay, so now I'm going to talk about the COVID-19 vaccines in general. This presentation is really focused on the Pfizer and Moderna products, those are the two products that have been issued an emergency use authorization, also called an EUA, from the Food and Drug Administration. So these are the two products that you can get right now. And then some of you may have also heard that Johnson & Johnson submitted to get their EUA issued for their vaccine. So hopefully we will have a third product very soon, which means we will have more doses to give to more people, which will be great. So this graphic right here just explains how clinical trials work. As I'm sure you're aware, we get a lot of questions about how this vaccine was made, how it was made so quickly, etc. There's a deal of fear about that, which makes sense, of course. So just like to explain this a little bit. So multiple COVID-19 vaccines are in development, several of which have completed large scale or phase 3 trials. COVID vaccines are being held to the same safety standards as all vaccines. And again, there are two products that currently have an emergency use authorization. I'll talk a little bit about what that is later. But basically for vaccine trials, you start off with a very small group of healthy volunteers, and researchers just want to see, is the vaccine safe and are there any serious side effects? Once they see that it's not in this smaller group of people, they get more people, move into phase 2, where we have several hundred volunteers. So at this point, we are pretty sure that the vaccine's safe and there are not going to be serious adverse reactions, but we acknowledge that there might be side effects. So we try to figure out what those side effects are at this stage. And also whether this vaccine is working, because we want to make sure that if we're investing time and people and money, that there is some kind of immune response there. So then we get to phase 3, which is where you have thousands of volunteers, and researchers dig a little deeper to see how disease rates compare between people who get the vaccine and people who do not get the vaccine. You really get more data about how the vaccine can protect people from disease. And then phase 4 is when the vaccine is either issued that EUA or it is approved. FDA will only approve a vaccine if it's safe, effective, and most importantly, if the benefits of getting the vaccine outweigh the risks. And researchers and the FDA and CDC continue to collect data on the vaccine's long-term benefits and side effects. If you do get a vaccine, there's a way for you to participate in this process. So CDC has a program called Be Safe. Once you get your shot, if you sign up for it, CDC will send you daily and then weekly texts to see how you're feeling, to see what side effects you do or do not have, and to see if you have gotten sick, just so we can learn more and more about these new products. This is really just all to say that these COVID vaccines are being held to rigorous safety standards. They still must move through the same different phases of all other vaccines, and there are a lot of different steps that a vaccine has to go through to make it to the approval process. So what is an emergency use authorization, or an EUA? This is a process that helps facilitate the use of medicines and vaccines during public health emergencies like the COVID pandemic. For a COVID vaccine to get issued an EUA, it has to be at least 50% effective. The ones that have been issued EUAs are well above that. Trials also needed at least 2 months of safety and efficacy data. So just at least 2 months worth of data showing that the vaccine was not going to cause serious adverse reactions and that the vaccine worked after completion of 2 doses. Submissions are also reviewed by an independent committee. It's called the Vaccines and Related Biologics Vaccine Advisory Committee, or the VRBAC for short. That's just to say that there are independent experts and scientists who review these vaccines. It's not just the FDA. And I'll just say it again, COVID vaccines are being held to the same safety standards as all vaccines. But then we have Operation Warp Speed, which again has instilled a rightful fear in people that these vaccines were sidetracked. Maybe there wasn't enough attention paid to them, etc. So why were these vaccines issued so quickly compared to other vaccines in the past? So researchers used existing networks to conduct COVID-19 vaccine trials. While COVID-19 is, of course, a novel coronavirus, scientists have been studying coronaviruses for years, and not just coronaviruses like the common cold, which has been around for a long time, but also coronaviruses that caused similar epidemics and pandemics like SARS and MERS, which I'll talk a little bit about later. The main difference here was really had to do with manufacturing. So manufacturing began while clinical trials were still underway. So while we were still getting all the data about safety and efficacy of these vaccines, the vaccines were already being made. So once they were approved, they would be good to go and good to ship out to the cities and states that are distributing them. Normally, manufacturing doesn't begin until after completion of the trials, which really slows down the process of getting it into arms. mRNA vaccines are also faster to produce than traditional vaccines. So both the Pfizer and Moderna products are mRNA vaccines. I'll talk a little bit about what that means later. And lastly, FDA and CDC are prioritizing the review and authorization of COVID vaccines above other things that come to their table for what I'm sure are obvious reasons, just the severity of the pandemic. So these are the two vaccines that are currently approved under an emergency use authorization. So we have the Pfizer vaccine and the Moderna vaccine. They both are mRNA vaccines. They both require 2 doses. The Pfizer is recommended to be given 21 days apart. The Moderna is recommended to be given 28 days apart. The Pfizer vaccine is approved for people age 16 and up, and the Moderna vaccine is approved for people age 18 and up. Both of these vaccines have been found to be about 95% effective in preventing COVID-19 in clinical trials. That's really, really, really good. Most vaccines that we have used are not that effective. However, it is unknown how long protection from these 2 vaccines might last. So we know that you have to get 2 doses to be protected 95%. We don't know how long that 95% might last. It's possible that a booster shot might need to be given in the future, but we don't really know that at this point. This is just some more data about the clinical trials. All of this is really to show that for both of these products, many people were enrolled in the clinical trials. So for Pfizer, almost 44,000 people. For Moderna, almost 30,000 people. So a lot of people have received these vaccines already, not to mention all the others who have received it through distribution processes. The trials were held in a variety of clinical sites in many states, 39 for Pfizer, 32 for the US. And the racial and ethnic distribution is roughly what you see for the national racial and ethnic distribution. Of course, it does not match Philadelphia's racial and ethnic distribution, but these clinical trials were fairly diverse. Most importantly, they included a large number of older adults. So 45% of people in Pfizer's clinical trial were between the ages of 56 and 85. These are the people who we know have had the most serious adverse events from getting COVID-19, and we have prioritized them to receive vaccine. So these data are just to show that in the clinical trials, they also received vaccine without serious adverse events and with really good results. Okay, so what is an mRNA vaccine? So the 2 vaccines that are currently approved use a small strip of genetic code called mRNA. The code teaches your body how to make the spike protein found on the COVID-19 virus. So once that code is injected into your muscle, your body makes the protein. Then your immune system recognizes that spike protein and will create antibodies for it. And these antibodies are the proteins that fight infections. So they stay in your body and they can fight off COVID-19 if you are exposed. So is this new technology? I mentioned a little bit about this earlier. So these COVID-19 vaccines are a new type of vaccine. However, they have been studied for years, which is one of the reasons we were able to get this out so quickly, because a lot of the work had already been done. And again, it includes research not just on our common coronaviruses, but also on past outbreaks of other coronaviruses that were more serious, like SARS and Middle East Respiratory Syndrome, or MERS. So these vaccines are expected to produce symptoms or side effects after vaccination, especially after the second dose. Most commonly, people experience fever or feeling feverish, a sore arm from where you got the shot, and you can also feel achy. So you can have a headache or you can have muscle aches. So really, we say that this indicates that the vaccine is working and it is creating an immune response in your body. No significant safety concerns were identified in clinical trials. Okay, so going to move into some of the facts and top-line messages that you can share with your constituents. COVID-19 mRNA vaccines will not give you COVID-19. None of the COVID vaccines in use or under development use the live virus that causes COVID-19. Again, the Pfizer and Moderna vaccines use a technology called mRNA. People can experience normal side effects like fever after vaccination. These are signs that your body is building immunity. And it does take a few weeks for the body to build immunity after vaccination. And for the ones that are approved now, it does take 2 doses to reach that 95% level of immunity after vaccination. Receiving COVID vaccine will not cause you to test positive on COVID-19 viral tests. There is a possibility that you could test positive on an antibody test. This would mean that the vaccine caused an immune response in your body and that you have a level of protection against the virus. So I think this is a pretty common question. If I already had COVID, should I still get the vaccine? Yes, people who have been sick with COVID will still benefit from getting vaccinated. This is mostly because we don't really know how long natural immunity lasts from getting COVID-19. Natural immunity is the immune response that your body builds up when you get an infection. On average, it seems like antibodies last about 90 days after getting infected with COVID-19. So getting a vaccine dose will further, it will make it more so you definitely will not get sick again. This is also an important one. There is no charge for the COVID vaccine. It was purchased by the federal government, so there's no charge to anybody getting the vaccine. There is also no copay required to receive the vaccine, and insurance and proof of citizenship are not required to receive the vaccine. Your provider may ask you for insurance, but it's not required to receive it. This is another common question that comes up. Do I still need to use precautions after getting vaccinated? It's very important for people to continue to wear masks when in public and around people they don't live with, and to social distance even after vaccination. So stay 6 feet away from people you don't live with and continue to avoid crowds, especially crowds in indoor spaces. So it does take time for the vaccine to be fully effective, about a week or two after getting your second dose. So again, you don't reach that 95% level of immunity until that point. And then most importantly, while this is rare for vaccines, we do not know if you can be an asymptomatic spreader with the vaccine. So we don't know until enough people get the vaccine and there is herd immunity, if somebody who was vaccinated can spread it to other people who have not been vaccinated, and if those people can get sick. It's just something we need more data on, and we need to see more people get vaccinated for a longer period of time before we know that. Who should not receive vaccine? This is another pretty common question. It's not too many people actually, which is great. So if you have a previous severe or immediate allergic reaction, like one that causes anaphylaxis or requires a medical intervention to a COVID-19 mRNA vaccine dose or any ingredient in the vaccine, they should not get vaccine. Right now, anybody younger than 16 years of age is not authorized to receive vaccine under the current EUAs. That is because of who was included in the large phase 3 clinical trials for those two vaccine products. So again, the Pfizer vaccine, 16 years and older can get it. The Moderna vaccine, 18 years and older can get it. They are still doing clinical trials with different age groups, so this might change in the future. I think Pfizer and Moderna are testing persons aged 12 and between 12 and 18 right now. People who are currently isolating or sick with COVID-19 should not get vaccine, not least of which because they should not be exposing clinic staff to COVID-19. However, again, they can get vaccinated once they're done their isolation period and their symptoms have resolved. Okay, so this is just a summary of the benefits of COVID vaccine. Getting the virus that causes COVID might offer some natural protection. We don't know how long this protection lasts. And the risk of death and severe illness from COVID far outweighs any benefits of natural immunity. So it's important to get the vaccine, even if you did have COVID. It will protect you by creating an antibody response without giving you the risk of severe illness. None of the COVID-19 vaccines in use or under development use the live virus that causes COVID-19. And COVID-19 mRNA vaccines will not cause you to test positive for COVID-19. Okay, I'm going to move into the vaccine rollout, so who can get vaccine and how. This is a graphic of the different phases of COVID vaccine distribution. So as I mentioned earlier in this presentation, we are currently in phase 1A and 1B. So we're somewhere in this red circle where we do not have enough doses for anybody who wants them, which means we have to give vaccine in closed settings like workplaces and mass vaccination sites that are specific to populations who can get it. Eventually, we will move into phase 2, where we have enough supply to meet the demand. So that means we can expand beyond our initial high-risk populations, and it means that vaccine will be available in a lot of different settings. Your doctor's office might have it, clinics will have it, health centers and pharmacies already do have it, so that capacity will just continue to increase, and we will likely continue to have it at public health venues as well. So clinics, mobile clinics, health centers, and mass vaccination clinics. So phase 1A, these were our very first people who we approved to receive vaccination in the city of Philadelphia. They include people with a high risk of exposure to the virus and people with a high risk of transmitting that virus to vulnerable people. So this is really our patient-facing healthcare workers in the city. You can see the list of people on the left-hand side. It also includes direct service providers, which I did not update this slide, but we did recently add those to phase 1A. It also included people at high risk of morbidity and mortality, including persons living in long-term care facilities. So how have we been doing this? Hospitals have their own occupational health units where they can vaccinate their staff. The health department has hosted a number of clinics and mobile vaccination teams for different healthcare settings. And as early as phase 1A, we did partner with other healthcare providers like pharmacies, clinics, and community-based organizations. There was also the CDC Pharmacy Partnership for long-term care facilities. So first in Philadelphia, they were going into skilled nursing facilities or nursing homes to vaccinate staff and residents. And I think they are still wrapping up this program, but they have moved into vaccinating people in assisted living facilities and personal care homes. So this was really a great way to get vaccine out to people living in congregate settings who have very high risk of morbidity and mortality. So phase 1B, we are also vaccinating persons in this phase, slowly but surely. We estimate that there could be as many as 400,000 Philadelphia residents who fall into this phase. We are receiving about 20,000 doses per week from the CDC. So it's really going to take us some time until we can even work through these really high priority populations, let alone get to some of the other populations. So these include people who are our frontline essential workers, so our first responders, our service providers who work with high-risk populations, public transit employees, food distribution, preparation, or food service, childcare and education providers. So this includes teachers, staff of educational facilities, as well as daycare and childcare workers, high volume essential retail. So these are people who work in large stores that have been open throughout the entire pandemic, that they sell essential goods, manufacturing, and we are also vaccinating people at high risk of morbidity and mortality. So people living and working in non-healthcare congregate settings, so anybody who wasn't included in phase 1A, people over the age of 75, and people with high risk medical conditions. And you can find the definitions for these groups on our website as well. Eventually, we will move into phase 1C. We are not there yet. As I mentioned, we have a very large population in phase 1A and 1B that we are still working to get vaccinated. But the next group up will include some other essential workers who do not have as high of a risk of exposure. So sanitation workers, maintenance workers, utility workers, so people working at utility companies, USPS, higher education, some essential finance, transportation, and construction workers, some essential IT and telecommunications workers, and essential public health and legal workers. And we'll also move into vaccinating people over the age of 65 who have not already received vaccine in this phase. So these vaccination strategies are a little bit more open than just for phase 1A. So agencies might host vaccination clinics operated by their occupational health units or a contracted partner organization. We have more and more vaccine available at retail pharmacies. So that includes Rite Aid, Walgreens, Walmart, and ShopRite right now. We also have some independent pharmacies who are going to different essential working populations and congregate settings to vaccinate people. Vaccine is available at many of the city's FQHCs and outpatient clinics, which is really great. They are contacting their high-risk residents who are eligible in phase 1B right now to get them vaccinated. These places are, located in neighborhoods and are a lot of the places where people who are at high risk already seek care. So it's great that they can distribute vaccine. I'm sure you all have heard a lot about mass vaccination clinics. So the health department and others continue to host those. And we also hope to increase our capacity with community-funded partners. So the only community-funded partner we have right now is the Black Doctors COVID Consortium. We have issued a request for proposals for others who are interested in providing vaccine in neighborhoods at the community level. Typically, this involves more of a healthcare organization partnering with a community-based organization to get this done. Okay, so how can I get vaccine? The best thing you can do is register for COVID vaccine on our vaccine interest form. This form is available in English and Spanish, and if you have your browser set to a different language, it will automatically translate to whatever language your browser is in. We hope to formally have more languages up very soon. You can access this form at phila.gov/vaccine-interest, or if you or somebody you know is uncomfortable using a computer or the internet, we also offer the service by phone, and we do have phone-based interpretation available as well. So you can call this number or 311 to get that filled out for you. We also added this form in the last couple of weeks to register your business to receive COVID vaccine. So the difference here is if your organization or company is interested in getting all of your employees vaccinated, perhaps at the same time, maybe by a pharmacy provider at a mass vaccination clinic, you can complete this form. Again, you can do this by phone or at this website linked here. It does ask for an EIN number. That is a required field. But basically you just enter how many employees your organization employs. It'll go through some details about what phase you might fall in, and then we'll contact you once we have vaccine. So I have a few slides about how we are achieving racial equity in COVID vaccine distribution. Taking up more time than I thought I would, so I'm sorry I'm talking so much, but I do think
time.
Important, and people have lots of questions about this, so I will just go through these slides as well. Okay, so the first thing we want to do is improve access to vaccine. So this is about who is getting access to vaccination appointments and how easy is it for multiple populations to get those vaccine appointments. As I mentioned, we have positioned vaccine in our health centers and also in retail pharmacy chains that are located in low-income neighborhoods and that are staffed and used by people of color. I mentioned our partnership with the Black Doctors COVID Consortium. Again, they're our only community-based partner right now, and they're doing really awesome work getting people vaccinated in neighborhoods and people who are eligible for phase 1B. We are also prioritizing vaccine access in geographic areas that have low vaccination rates and that are vulnerable per the CDC's Social Vulnerability Index. So when we issue vaccine invitations, people living in these zip codes that are more vulnerable may have more access to those appointments. And I also mentioned that we did issue the request for proposals for community-based vaccination partners. And if there's any interest in that, I can send the link around later. We are also improving our data quality and data sharing practices. So I already showed that we are publishing data by race, ethnicity, gender, age, and I put eventually here, but we actually have it now, and by zip code of residence. So we can be transparent about who is getting vaccine and what kind of work we still need to do to make sure that distribution is equitable. We are bringing more and more sites on every day to distribute vaccine, and we do require them to report these data. So we have a good and accurate sense of who is getting vaccine. Outreach and engagement is a really important part of this. So hosting virtual town halls like this one with community leaders and residents to listen to concerns and answer questions. Residents are also the experts here, and we want to make sure that our messaging and our plans rightfully reflect the opinions of leaders and residents. We are working on some plain language materials that are culturally competent and will also be translated. And again, we work closely with community partners to get these materials to many different audiences. We have trained our call center staff to talk to folks about vaccine and register them for the vaccine interest form. So this is really to make some attempt to approach the digital divide in the city. So a lot of these things are accessible via the internet, and that's not easy for everybody. So we want to make sure that we have a phone-based option. We are also working with Philly Counts. So they led a really awesome engagement effort around the census last year. So they're going to be doing this again with vaccine to train trusted messengers on vaccine messaging. Protecting essential workers is also another key piece of this. So we are working on plans to vaccinate our high priority essential workers. We are hosting listening sessions and focus groups for effective engagement with these groups. And we are also prioritizing essential workers from either zip codes with low vaccine rates or those that are affected by COVID-19. We have partnered with some unions and community-based groups who have better engagement with essential workers than we might, so they can get the messages out most effectively. Okay, so these are just a couple of resources. These are the different fact sheets for the 2 vaccine products that currently have EUAs. If you want to learn more about the vaccines, about their side effects, you can find them at these websites, or you could just Google it. I'm sure it will come right up. They're available in many, many, many different languages, and I'm happy to send along any of these as well by email. Our website is also a great resource. So there's a vaccines tab on the website, www.phila.gov/COVID. You can see our data, so you can see who's getting vaccine, but you can also review our planning documents. There's a bunch of frequently asked questions up there. And we also have this inbox as well for any residual questions, burning questions you have that we can't address today. We'll be happy to answer them through this email. So it's covidvax@phila.gov. Okay, so that is it. I will pause here and see if folks have questions for me.
Alexander, this is Mark. So a question just popped up. Can you explain efficacy? Is that really how effective a vaccine is from preventing you from getting COVID? I heard Johnson & Johnson is only 68%.
Yes, that is correct. So efficacy is how effective a vaccine is from preventing you from getting COVID-19, from getting sick with COVID-19. The Johnson & Johnson vaccine is 68% effective from preventing anybody getting any kind of illness from COVID-19, but it is, I think, over 80% effective from preventing the most serious outcomes of COVID-19, including hospitalization and severe illness. And I think this is a pretty important point because that's really what we want to prevent, is people getting really sick that they need to go to the hospital, or that they might have long-term impacts, or that they may even die, which is what we've been seeing. If we can get COVID to behave more like a common cold through vaccination, that's a big win for us. So even though the Johnson & Johnson vaccine, those numbers look a little bit lower, it's still going to be a really great product. And it's only 1 dose, which is logistically really awesome for us and for a lot of populations.
Is there a timetable that you know of that the Johnson & Johnson vaccine will be rolled out? Are there any plans of how to do that for those maybe at less risk?
I do not know. I just know that they submitted their application to get the EUA a couple of weeks ago, and I'm not really sure where that process is, to be honest. We are having internal conversations at the health department, but also with our vaccine advisory committee. Our vaccine advisory committee is something that we stood up, I think in September when we first started this planning, has local subject matter experts and community-based folks, as well as some communications people, healthcare people. they've really been advising us on our plans. So they will advise us as well on which populations they think might be best for this vaccine once it's available.
Great. Another question just came up. Are there vaccines going to waste because people don't show up for an appointment? What are they doing with those vaccines? Is there a way to get on a list to get it on a waiting list at a pharmacy?
That's a good question. So pharmacies, the health department, health systems, we all work really hard to plan so that does not happen. That's why it's really important for when you set a vaccine appointment to come to that appointment if you can, to let us know if you can't make that appointment so we can reschedule you. Vaccine, as far as I have heard, there have not been any serious issues with vaccine wastage because of that type of planning. I can really only speak for the health department. We do not have a specific waiting list for people for end of day doses at the moment. I'm not sure if any pharmacies do. That would have to be a question for the pharmacy.
When you reference, and we certainly have heard about the vaccination shortage, are you privy to any information of when you believe, increased doses will be circulated to places like Philadelphia?
I do not know the answer to that question, unfortunately. I will say that the distribution is population based. So we get a certain percentage based on how many people live in this city. And that's the same for every jurisdiction. So every state and city that is getting vaccine. So we won't get more than somebody else once more doses are available. We will just get kind of the relative number that goes with our population.
Great. Another question from the chat. You mentioned mass vaccination sites. Are there any plans for more mass vaccination sites in Philadelphia once more vaccines are required? And what venues would those be?
Really great questions. So we are starting our community-based mass vaccination sites this week. We will be operating 3 different sites in different neighborhoods throughout the city this week. And then in 3 weeks, we will operate at 3 more sites. So we'll do second doses for people who are getting them this week, and then we'll add 3 more sites for a total of 6 mass vaccination clinics per week. You also may have heard that we are getting a site at the convention center that is going to be operated by FEMA. They will be doing a large number of doses per day. So that'll also be a good opportunity to get a lot of Philadelphians vaccinated. The sites really for health department clinics are based on a lot of different factors. Right now, I think we have our sites set, and then once we do have more vaccine and more capacity to do more clinics, we might add additional sites.
And for our participants today, as well as Alexandra, we actually reached out to the Office of Emergency Management, and I know they're looking into the Fillmore, which is in our district, as a possible site at some point. So hopefully that would come around as well. Next question. Do you have to live in Philadelphia to get the vaccine in Philadelphia?
Yes, that is something that we are requiring at this time.
Great. I don't want to hog it all. Does anybody have any other questions? Put it in the chat or certainly unmute yourself.
Yes, hi. I have a question. My name is Renee. I have some constituents in the area, zip code 19103 area. They are phase 1. And one of them works for Red Cross and was told they're eligible. But when she called her doctor's office and other places in the area, they told her that they did not have any vaccines. They were not doing those phases as of yet. They didn't have any vaccines for her yet. And when she tried to mass one of the mass clinics, they said she tried the health department rather, and they told her she needed to be a patient of the health centers before she can get vaccinated.
So The latter part is not entirely true. I'm not sure who this person is and what exactly they do or what phase they might fall into. The best thing that they can do is sign up for our vaccine interest form. So we are inviting people who sign up for that form to our mass vaccination sites. We're doing that all this week for our sites that we're operating this week. So if she does fall into one of our prioritization categories, she can expect to get an invitation at some point. Yeah.
All right, thank you.
You're welcome.
Thanks, Renee. Does anybody else have anything? Going once, going twice? Well, I want to thank Alexandra and her team. I know this is a very, very busy days for her and her staff, and I appreciate you taking the time today. I know it's been informative for us. Certainly keep up the great work. Just so everybody knows, we have recorded this, so this will be in our weekly email newsletter, which if you don't get, you can sign up at thefishtowndistrict.com. We'll also have it on Facebook at the Fishtown District. So keep a lookout there, and certainly Alexandra, through her presentation, gave you several resources to reach out. If you have any questions, reach out to us. Alex, any final words before we adjourn?
Just thanks so much for having me. This is why we're here, is to give information to residents. So I'm really glad I got to talk with you all today. Had some really great questions. Please reach out via those resources I mentioned if you have more questions, and please sign up for our vaccine interest form so we can see you all get vaccinated. Thank you.
Thank you, Alex. Thank you, everybody. Have a great day and stay safe.